In this video, you and your family will be introduced to the process of receiving radiation therapy. Many people view radiation therapy as mysterious and complicated because they don't understand how it works. This overview of the steps in the radiation therapy process will prepare you for your treatment and help to alleviate any fears or concerns that you may have as you begin your journey through treatment. Radiation therapy is the use of high-energy X-rays to destroy tumors. This radiation is similar to the kind used to take an X-ray picture of a broken bone. It can't be seen or felt. Radiation destroys the cancer cells by stopping their ability to divide and grow. While normal non-cancer cells also receive radiation, they recover more easily from the radiation effects. Radiation therapy can be given in two ways, internally and externally. With internal radiation, a radioactive material is placed inside the body, close to the location of the cancer or tumor. External beam radiation is produced by a linear accelerator. This is the most common type of radiation therapy and the one that we will explain in detail. Your process of receiving radiation therapy begins with a consultation. You will meet with a nurse, a resident physician, and a radiation oncologist who specializes in the treatment of your specific disease. Each member of the team plays an important role in your care. Your radiation oncologist will review your medical records and medical history, perform a physical examination, and discuss your treatment recommendations with you. There are also social workers, dietitians, insurance specialists, and other professionals available to address any concerns that you may have. You will be asked to give permission or informed consent before treatment begins. You and your nurse will discuss the daily routine of radiation therapy. Radiation treatment occurs once per day, Monday through Friday, at the same time each day. The therapist will give you a list of available times to choose from to have your daily radiation treatment. Your radiation oncologist will determine how many treatments you will need based on your specific diagnosis. The next step in the process helps your team create your individual treatment plan. It is called the simulation. During simulation, the radiation therapist places you in your treatment position, and the CT scanner takes X-ray images of you. Immobilization devices such as a headrest, face mask, or a foam cradle may be used to make sure that you are positioned in exactly the same way for each treatment. These immobilization devices will be used throughout the course of your radiation. You may need to drink or receive an injection of a medical dye called a contrast agent. This will provide the doctors with a higher quality picture of your treatment area. Several markings may be made on your skin to help ensure proper positioning. These marks must remain visible throughout treatment. Some of the marks may be permanent, while others can be removed at treatment completion. As a safety measure, your therapist will take a picture of you for identification purposes. A picture will also be taken to document your position on the treatment table. When the simulation is completed, your therapist will give you the date and time of your first appointment. An individual treatment plan must be developed for you before your treatment can begin. This entire process can take from several hours to several days, depending on your diagnosis and the complexity of your plan. The goal of the treatment plan is to create a way to deliver radiation to effectively treat the tumor while sparing the surrounding healthy tissue. Your radiation oncologist will review the simulation images and identify the specific area to be treated. Once the treatment plan is finalized, the medical physicist, radiation oncologist, and therapists each perform their own double checks for safety. At your first appointment or filming session, X-rays are taken to confirm that the position you are in is exactly the same as at the time of simulation. Your radiation oncologist will review and approve the films, so your actual treatment can begin on the following day. This session may take 30 to 60 minutes. During the course of your treatment, your radiation oncologist, resident physician, and nurse will see you weekly for an on-treatment visit. During this visit, your vital signs may be checked and radiation side effects will be assessed. Don't hesitate to ask questions and discuss your care with your team. You may experience side effects from your radiation treatment. The most common side effect is fatigue. Patients describe feeling weak, worn out, and tired. Some helpful tips are getting 8 hours of sleep each night, taking frequent naps and rest breaks, and exercising. You may experience other side effects specific to the area of your body being treated. For example, a patient being treated for head and neck cancer may experience an inflammation of the lining of the mouth. This may be treated with an oral rinse. Your nurse will discuss any potential side effects and their recommended treatments. On the last day of your treatment, you and your nurse will discuss your follow-up appointments, reasons for calling your physician, and management of your symptoms. They will also answer any other questions. On the very last day of your treatment, the staff invites you to celebrate the completion of your radiation therapy by ringing the end of treatment bell. Your day has come to strike the bell. Your silent heart has much to tell and much to toll this proud new day. Treatment done. You're on your way.